whatever it is, comes up and sits in this little notch right
Yes.
at the top, up here. And so she's very, if you get her to gently open her mouth, and now close again. So you should feel, now again. Why can't I feel it beautifully? Now again.
You might not feel it, but I can.
Yeah.
That's you're so
There
on
it
it.
is.
You're so on it.
Yeah, okay. If you can't find the TMG easily, find that little notch at the back of it. All right, and because she's very tender, I'll get you to feel your own. So feel your own TMJ and feel the little notch at the back in front between the TMJ and the ear. So that's what you go for if you can't find that joint, because it's got a nice strong ligament right over the top, say, for example. Okay, and now open your jaw and feel that notch move forward. Okay, and then you can feel the way the, whatever this bone is, sticks up and sort of hangs off the zygoma. Okay, feel it there, and then you can feel the TMJ quite well, like that. Also, I want you to run your finger along your zygoma, along the bottom of it, along here, and with your jaw opening and closing, I want you to feel that point. Let's have a look at Horace over here. Let's stick his jaw back in the right place. So when you open and close your jaw, I want you to see if you can feel this appearing beneath your zygoma, this point here. Okay, because that point is where, is it the temporalis or the masseter?
No, temporalis.
Temporalis, okay, so it attaches to this point here. Now she is so tender with this opening that that point is quite difficult to, and it's quite hard enough to find on yourself,
I think
isn't
this
it?
made ache all around the message.
Yeah, okay. That might cause trouble in everyone. Okay, well, so you can imagine that it's not easy to get to that point, but she's really, really tender on that point.
I don't think it comes out totally. Is it supposed to come
No,
out? so
it
you
doesn't
can
come
feel
out.
it? No,
No,
you just get
so
under
to
and-
get it to stick out, you've got to do that. And you can actually get it to stick out a bit, enough to get a needle onto it anyway. And don't forget that your stuff spreads about 1 centimetre.
Yeah.
So we want to follow that out along here, and then you can feel the front of the jawbone there. Okay, so that's this bone here, and then when she opens her jaw, if she can, then right up in there is that point. Okay, so I'll mark the bottom of the zygoma there, and where it actually is going to depend at the moment when we do the injection. Now, this point here, can anyone get me that first volume 1 of that red book by Travell and Simons, which is on the book table still? So that this painful point here, I think, is a trigger point in either temporalis or masseter. Which do you think it is, Chris?
That's the temporalis.
Temporalis, okay. Okay. I think that's the trigger point we're looking at. And see, here's this muscle that attaches to that point that I've been trying to get you to feel. See, they've chopped away the zygoma there so you can see it. See all this fibrous stuff here?
Oh, yeah.
So really, if her trigger point is here, this bottom one, then probably the spot that we really need to get to is this spot here. So rather than sort of all that part of it, maybe we need to be getting to that point there to help this trigger point. Make sense?
Yeah.
Along those same fibres. Are you getting pain in your teeth, Rhonda?
No.
Good, okay, because that's the other 3. See, they've all got referral to the teeth, but this one doesn't. So we want to try and get that. Now let's have a look at masseter. What did we find?
3:30.
Thanks. Oh, masseter. That's right. So she's not got any problem in the teeth. What if we put it on your tummy? The patient's tummy is a wonderful place to put a book. But she's getting pain in her ear. Are you still getting that pain in the ear, in here?
It's At this second, it's okay. But it, you know, like when you did it last time, it was, but it hasn't changed. I'm still getting the benefit
Okay.
of our last session.
Well, that's good. So, obviously, I'll try. See, there's a trigger point there, which is giving that pain. So that one's going to be as tricky as anything to get
So
that
it's
through.
2 heads, isn't it? Is that a head
Yeah, that's the inside head.
internal to the
Yeah. So we're going to have to go
mandible?
through that little gap there to get to that trigger point.
Do you ever approach those muscles through the buccal
No,
mucosa?
this is the first time I've done this. Last time I treated you was the first time I've done these, Rhonda.
You haven't had any failures? So.
Beg your pardon?
You haven't had any failures?
No failures yet. 100%. But the other thing I did for Rhonda was a sphenopalatine ganglion block, which gave you a lot of relief in the side of the face, didn't it, Rhonda? You really thought that was a good one, didn't you? So I hadn't done that on her before. I suddenly thought, oh, why am I not doing this?
That's the one that was here?
Yeah,
or
that's right.
thereabouts?
Yep.
Yeah, it's
It starts from a point halfway between the ear and the eye. It's a neural therapy one, and it looks much harder than it actually is. So we'll do that one. Now let's see.
What's that good for?
For a lot of different pains in the face, including sinusitis and trigeminal neuralgia and facial pain of various sorts. The sphenopalatine ganglion is... for the sphenopalatine ganglion, which I'll show you on Horace. You handle that. Your injection goes halfway between the eye and the ear, just above the zygoma, and it heads over that way, and the sphenopalatine ganglion is about there. And you aim the needle for this wisdom tooth on the opposite side from that point. So you're aiming it at about that angle. And it just goes in really simply and easily. And did you manage to get that on film? So here's the tooth we're aiming for, and here's the angle that you're heading for. And some people do this from inside the mouth, but I wasn't taught to do that. I was taught to do it this way, so this is the way I do it.
Which wisdom, sorry, the top one or the
Top one.
top one?
Mm-hmm.
Is it the lateral border of the eye, is it? Or the eye? The
Lateral border,
canthus?
lateral canthus.
Yeah, lateral
Yeah,
canthus.
yeah.
And
And the ear,
which part
halfway
of the
between
ear?
the two, the
The
front
front
of
of
it,
the ear.
the front of it, yeah.
I wonder what else is in it.
Don't want to go. Don't want to go.
Temporalis.
We'll have to get the anatomy out.
There's a front.
You're putting a needle through it, okay, with local anaesthetic. It's not anything too terrible.
And does she feel a twitch or something when you hit that?
No,
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 nothing. How do you know you've hit the right spot then?
no. Because you touch bone.
Oh, do you? All right.
Yeah.
Okay, that's good.
So I reckon that there's bone up to there. Sorry if I'm pushing too hard, Rhonda. And there's the bottom of the zygoma is running along there. So I reckon if we just go in with her face in a relaxed attitude, we should be able to get that trigger point that's referring pain into her ear, and from about that angle, don't you reckon? There's the diagram there. We want to get up. I reckon that'll do it. Well, you've got to try, haven't
The
you?
one
Because
you
she's
got
having
there, I
such a lot of
think
pain.
that's the temporalis that you're saying. That would be a lovely
This
spot.
one is the temporalis up here,
Oh,
yeah.
the masseter here.
But the masseter refers pain into the ear, like this. Okay, so we're on masseter now. Okay, so there's the masseter trigger point we're
That's the
looking at.
temporalis.
Oh, sorry, temporalis. Masseter, sorry, yeah. There, so that's the one, that's where we're trying to address that pain now by that trigger point.
Yeah.
Okay, so we're going to put one in there and hope to get this pain. We're going to do the sphenopalatine ganglion. We're going to do the top of, what is that bone called that attaches to? The top of the mandible. Coronoid process.
Yeah,
Coronoid process, that's what it's called. So we're going to try and get the top of the coronoid process, but that's going to be with prolotherapy solution. And the scar is going to be local anaesthetic alone. Now, what have you found around there? Oh, I did do some right round
Yeah,
here,
that's
didn't
that
I?
one that's one of the first ones that I start to get it back.
Around here. Okay, well, lots of people with headaches get problems around here. I might get you to lie on your side and we'll show that one.
Sorry.
Excuse me. Normally, when I treat these points at the back of the head, I have the person lying on their tummy. So there's, but it's these gallbladder 20 points if you've done the acupuncture. If you feel at the back of your head, there are a couple of very tender points along the bottom of your skull, okay? And they are fantastic to treat with prolotherapy for headache.
So this origin of the
Lots of muscles.
Semis,
Lots of
spinalis
muscles.
and-
Yeah, all those sort of things. So where's that spot again, Rhonda? Right up there, okay? Now, quite often, patients are, when they've got headaches, they are even better than you at finding the points on the skull. So if that one's there, are there any other ones around here, Rhonda?
Well, have you got that one?
Yeah, I've got that one marked. What about the tip of your mastoid?
The-
Sometimes the
It's
tip
not
of the
so
mastoid...
bad now,
But it was bad,
yes,
wasn't
it
it?
was, and it does get bad.
There it is.
That's right, you've got it.
Okay, so there's the tip of the mastoid. We've got to do that one. Okay, well, let's...
So this trigger point for the headaches at the back, you said it's great for headaches. You don't take a history to see what kind of headache, you just do it for every headache, do you? Or is there
Well,
any
hers is
particular-
going to be musculoskeletal, isn't it? You know,
Right.
she was a successful woman. She didn't get a lot of... As far as I know, she didn't have chronic sinus or things like that. So she's probably not an allergy person. She's had this huge mechanical insult to her head. You know,
When she
imagine
did
how
a
they would have thrown her
prolotherapy
around
workshop.
when she was unconscious and they were scared of losing her. You know, there would be all sorts of injuries going on. And so it's a musculoskeletal one. But, you know, if I wasn't getting better, I'd be then
You
talking
give the
to her about a
caffeine.
low amine diet or a milk-free diet, which we'll come to tomorrow.
All right.
And it's interesting because migraines are often really sore around there anyway.
Mm,
you know,
absolutely.
it's a combination of. So
Absolutely, yep.
it'd be interesting to treat those for migraine.
Okay, let's keep moving on.